Friday.
All right, Assalamu alaikum, everyone. Thank you so much for joining today. I'm really excited about this talk. We have a speaker who we've had before in our first series, in our Women's Health series, talking about mental health. And so it's a delight to bring Dr. Mustafa by Abdul Hussein back on this webinar. Thank you to each and every one of you for attending, and I hope you find it useful. As always, if you have any questions, feel free to put them in the chat box, or at the end there will be time for questions. So you're welcome at that point to unmute. But if possible, during the webinar, if you can stay on mute, just not to interrupt the flow, if that's okay. So I'd just like to introduce Dr. Mustafa Abdul Hussein, who is originally from Sudbury, Ontario. He graduated with an honors in biomedical biology from locally, and then went on to earn his medical degree from Ross University. He completed his residency at the University of North Dakota in Fargo. And since graduating, he's worked in the outpatient setting, inpatient psychiatric units, nursing homes, consult liaison roles, emergency departments, and in inpatient eating disorders. He is currently working at the North Memorial Hospital in Minneapolis as a consult liaison psychiatrist, seeing patients who are admitted to hospital medicine and in the emergency department. He also sees patients via telemedicine in the outpatient setting. So, as I said, I brought he's come on before to do a mental health talk. This is something he practices on a regular basis. So yeah, I'm excited to see to hear his webinar. So without further ado, I'll hand over to him.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much, Dr. Fatima Ben, for that kind introduction. अपने पहला मौलाना हकमा दुआ करिए कि खुदा ताला अपना मौला अपना जानो से ओला आका मौला सैयदना अली कल मुफद्दल सैफुद्दीन उमर शरीफ ने ता रोज़ क़यामत दराज करे आमीन અને આપણે મોલાનો શુક્ર કરીએ છીએ કે SBMAA કાયમ કરવું છે જે સૈફી બુરહાની મેડિકલ એસોસિએશન અમેરિકા છે મોલાનાને જિસ્માની સેહત રૂહાની સેહતની ફિકર જ હોય છે અને આ SBMAA જે જિસ્માની સેહત છે આપણે મદદ કરે છે અને આ ટોક્સ કરીએ છીએ તો ઓબ્વિયસલી SBMAનું બી શુક્ર કરું છું કે પાછું મને ઇઝન આપવું છે ઇન્વાઇટ કરવું છે પાછું ટોક આપવાનું શાયદ લાસ્ટ ટોક મેન્ટલ હેલ્થના ઉપર હતું એન્ડ એપ્રિલમાં હતું મને એમ લાગ્યું કે પાછું એ લોકો મને ઇઝન નહીં આપે પણ અલ્હમ્દુલિલ્લાહ પાછું ઇઝન આપવું છે સો આજે આપણે સ્લીપના બારામાં આપણે કરશું આપણી વાત કરશું તો આ મારું કોન્ટેક્ટ ઇન્ફોર્મેશન છે પ્લીઝ નોટ ડાઉન કરી લેજો મારું ઈમેલ એડ્રેસ છે અને મારો વોટ્સએપ નંબર બી છે કાંઈ બી કામ હોય યા તો એડવાઇસ હોય તો પ્લીઝ મને ક્વેશ્ચન્સ બી હોય પછી બી પૂછવા હોય તો મને કોન્ટેક્ટ કરજો તો ઓબ્વિયસલી આજે આપણે સ્લીપના બારામાં ઊંઘના બારામાં આપણે વાત કરશું તો આ જે ટોપિક છે આજના તો ઓબ્વિયસલી પહેલાં મેં એમ કહું કે આ જે ટોક છે મને આઈ થિંક 1 કલાક છે ફરવામાં બરાબર 1 કલાક છે થોડું કમ
Yeah,
છે ટાઈમ
that's
થોડું
right.
કમ ટાઈમ ઇન્શાલ્લાહ લઈશ પણ આઈ થિંક કલાકો ને કલાકો એટલું કરી શકીએ સ્લીપમાં કે તમને ઊંઘ આવી આપણે વાત કરી શકીએ ઊંઘમાં તો એનીવેઝ મેં ટ્રાય કરીશ કે જેટલું કવર કરવાનું તો આ સગળી ટોપિક્સ છે અને ઇન્સોમનિયા આપણે ઈચ ઇન્ડિવિજ્યુઅલમાં થોડા ડિટેલમાં કરશું અને ઇન્શાલ્લાહ અમે વાત કરશું કે શું છે શું સિમ્ટમ્સ છે કેમ ટ્રીટમેન્ટ કરવાનું ઇલાજ કેમ કરવાનું આનું અને વેન શુડ યુ સીક હેલ્પ તમને ડૉક્ટર પાસે વાત કરીને કેવા જવું જોઈએ. તો ઓબ્વિયસલી આખું પ્રેઝન્ટેશન સ્લીપનું છે તો પહેલા તો ડિફાઇન કરીએ કે સ્લીપ શું છે કેમ કે આપણે બધા કરીએ છીએ આપણે રાતે દિવસના ભાગમાં નેપ્સ લઈએ છીએ જેવારે બેબીઝ કરીએ છીએ મોટાઓ કરીએ છીએ પણ એકચ્યુઅલી તમે ડિફાઇન કરવા જાઓ તો કેમ ડિફાઇન કરો તો ઓફિશિયલી એનું ડેફિનેશન આમ છે અને મેં વાંચું છું it's a state of reduced mental and physical activity or consciousness is altered and certain sensory activity is inhibited. So in Asate, you have a decrease in muscle activity and a decreased ability to see the environment around you or to perceive the and interact with the environment around you. You have a reduced ability to react to stimuli. It has very specific brain patterns, which make it distinct from coma or loss of consciousness. તો એમાં થોડું જુદું હોય છે. And then a lot of our, mostly all of our biological functions depend on sleep. And why do we need it? We need it because it restores a lot of our important functions, especially immune functions, nervous functions, our muscular functions, and obviously our brain, which is, a very important function of sleep, and it clears away waste products that is made during waking hours. One of the important ones is amyloid, which is a protein that's associated with dementia. So you want as little amyloid as possible. And then sawal થાય કે why is a psychiatrist talking to you about sleep? So there's a very good explanation for that, but mainly it's because જે સાયકાયટ્રીમાં જે દવાઓ વાપરીએ છીએ તો એ ઘણું સ્લીપ ઉપર અફેક્ટ થાય છે અને ઓલ્સો જે ડાયગ્નોસિસ હોય છે સ્લીપના તો એ સોરી સાયકાયટ્રીના તો એ સ્લીપ ઉપર ડિપેન્ડ થાય છે અફેક્ટ થાય છે સ્લીપને and a lot of the same neurotransmitters જે chemicals હોય છે બ્રેઇનમાં તો એ સ્લીપમાં અફેક્ટ થાય છે અને સાયકાયટ્રીમાં બી સ્લીપ થાય છે. Sleep has also been observed in all animal species from insects all the way to humans. So everybody sleeps, everything sleeps. These આ જે છે ને આ થોડું ડિટેલમાં કરું છું પણ just આપણે visually જોવાય કે there is different effects on our brain during sleep તો આ EEG છે અને જે wave patterns છે તો different stages of sleep માં આપણે સુનું હશે REM sleep or rapid eye movement sleep જે અહીંયા જોવાય છે અને જે ડીપ સ્લીપ્સ હોય છે એના સ્ટેજીસમાં આપણા બ્રેઇન એક્ટિવિટી એકચ્યુઅલી જુદી જુદી હોય છે ને એ આપણે જોવાય છે આ વેવ પેટર્ન્સથી ઇલેક્ટ્રિકલ એક્ટિવિટી જે છે બ્રેઇનમાં તો આપણે એવરેજ સ્લીપ સાયકલ લઈએ તો 10 વાગે સુવા જાય અને 6 વાગે ઉઠીએ તો આપણા બ્રેઇન આખા સાયકલ્સમાં જાય છે જુદા જુદા સાયકલ્સમાં તો પહેલા ઓબ્વિયસલી લાઇટેસ્ટ સ્લીપ હોય છે N1 કહેવાય છે અને પછી થોડું એનું હજી ડીપ સ્લીપ થાય છે પણ હજી લાઇટ સ્લીપ કહેવાય છે તો N2 પછી ડીપ સ્લીપ થાય છે N3 અને જે REM સ્લીપ થાય છે તો આમાં ખાલી એમ જોવાનું છે કે જે રાત જાતી જાય છે તો REM સ્લીપ વધે છે ડીપ સ્લીપ ઓછું થાય છે અને લાઇટ સ્લીપ બી વધે છે. SBMA obviously આખું મેડિસિન એફેક્ટ થાય છે સ્લીપ તમારા આખા શરીરને એફેક્ટ થાય છે તો આ ફોટોમાં જોઈએ તો હેડ ટુ ટો ફરક થાય છે તો બ્રેઇનથી શરૂ કરીએ તો ઇનફ સ્લીપ ના મળે યા તો ડિસ્ટર્બટેડ સ્લીપ થાય તો મેમરીમાં પ્રોબ્લેમ્સ થઈ શકે કોન્સન્ટ્રેશનમાં અને મૂડમાં બી ફરક પડી શકે તમારા હાર્ટ તમારા કાર્ડિયાક સિસ્ટમ પર જો તો હાઈ બ્લડ પ્રેશર અને હાર્ટ ડિઝીઝ બી રિસ્ક છે તમારું લિબિડો અફેક્ટ થઈ શકે છે તમારું બેલેન્સ અફેક્ટ થઈ શકે છે તમારો ડાયાબિટીસ અને વેઇટ ગેઇનનું રિસ્ક ઇન્ક્રીઝ થાય છે અને ઇમ્યુનિટી જેમ મેં કીધું હતું પહેલાં કે ઇમ્યુન સિસ્ટમનું ઇમ્પોર્ટન્ટ ફંક્શન છે સ્લીપનું ઓબ્વિયસલી તમે બરાબર ઊંઘતા ના હો તો તમે ઇન્ફેક્શન્સના ઘણા વધારે સસેપ્ટેબલ હોઈ શકો છો. એક ઇમ્પોર્ટન્ટ કોન્સેપ્ટ છે બીજું સ્લીપનું એ સર્કેડિયન રિધમ છે આપણે સુનું હશે પણ બેસિકલી આની માના એમ છે કે આપણા બોડી આખા સાયકલ્સ છે અને જે સ્લીપ વેક સાયકલ્સ છે તો એ આપણા એન્વાયરમેન્ટ અને જે ક્યુઝ હોય છે એનાથી ટાઈડ હોય છે ઇન્ટ્રેન્ડ હોય છે સો ફોર એક્ઝામ્પલ મોસ્ટ પીપલને રાતે ઊંઘ આવે છે અને દિવસના ભાગમાં ઊંઘ નહીં આવતી. તો એના એ સર્કેડિયન રિધમના સબબથી છે કેમ કે લાઇટ એ અફેક્ટ થાય છે. એક ઘણું કોમન એક્ઝામ્પલ છે. આપ સગલા જેટલેગ એક્સપિરિયન્સ કરવું હશે ડિફરન્ટ ટાઈમ ઝોન્સમાં આપણે ટ્રાવેલ કરીએ છીએ તો આપણે વાના દિવસના ભાગમાં આપને ઊંઘ આવે છે અને એ લોકોના રાતના આપણે આપણે ઊંઘ નથી આવતી. તો એ કેમ કે આપણા સર્કેડિયન રિધમ્સના હિસાબથી છે. તો આપણે એડજસ્ટ પણ આપણે એમ બી શીખે છે શીખી શકીએ છીએ કે આપણે એડજસ્ટ કરી શકીએ છીએ. થોડો ટાઈમ આપણે સ્પેન્ડ કરીએ આપણે પાછા આવીએ છીએ ઇન્ડિયાથી પાકિસ્તાનથી આફ્રિકાથી જે બી તો આપણે પાછા એડજસ્ટ થઈ જાય છે આપણા આ ટાઈમથી. ઘણા ઘણા બોડી રિધમ્સ એસોસિએટેડ હોય છે સર્કેડિયન રિધમ્સથી. આપનું બ્લડ પ્રેશર બી જીઆઈ ફંક્શન્સ આખું શરીર આપણા જે ઇમ્પોર્ટન્ટ ફંક્શન્સ હોય છે તો એ ટાઈડ હોય છે સર્કેડિયન રિધમ્સથી. આપને બરાબર ઊંઘ ના આવતી હોય એસ્પેશિયલી ઓવર ટાઈમ તો એકચ્યુઅલી તમારી ઉંમર પર ફરક પડી શકે લાઈક તમારું લાઈફ સ્પેન ઓછું થઈ શકે. Like I said, insulin resistance, including obesity and weight gain. Obviously, like I said, infections વધારે હોઈ શકે છે અને risk of coronary heart disease. કેમ કે calcification થઈ શકે છે arteriesમાં. તો આપણે ઇમ્પોર્ટન્સ આપણે વાત કરી સ્લીપની તો હવે કેટલું ઊંઘવું જોઈએ કેટલું સ્લીપ થવું જોઈએ. તો આપણે જે નાના બચ્ચાઓ હોય છે ઇન્ફન્ટ્સ હોય છે ન્યૂબોર્ન્સ હોય છે તો એ લોકોનું વધારે હોય છે સ્લીપ રિક્વાયરમેન્ટ. અને એઝ આપનું લાઈફ સ્પેન આપણે મોટા થાય છે તો ઓછું જરૂર હોય છે સ્લીપની. આઈ થિંક મોસ્ટ આ પ્રેઝન્ટેશન વાસ્તે આ જે લાસ્ટ 3 હોય છે આઈ થિંક એ જ ઇન્ટરેસ્ટ હશે વધારે. તો જે નાના બચ્ચાઓ હોય છે તો એ લોકોને વધારે જરૂર હોય છે 9 to 12 hours. Teenagers થોડું ઓછું અને adults should aim for at least 7 to 8 hours of sleep. જી છે સવાલ છે.
I think
Okay.
someone had just unmuted. We'll do questions at the end.
Sure, sure. All right. So આ બી ટર્મ આપે સુનું હશે કે ના ટર્મ સુન જ હશે તો પણ મેં જો થોડું રિવ્યૂ કરી લઉં છું અને આપને ઇન્ફોર્મેશન વાસ્તે આપું છું. તો સ્લીપ હાઇજીન શું છે અને વાય ઇઝ ઇટ સો ઇમ્પોર્ટન્ટ. તમારા ડૉક્ટરે કીધું હશે કે વોચ યોર સ્લીપ હાઇજીન પ્રેક્ટિસ ગુડ સ્લીપ હાઇજીન. It's not like dental hygiene or body hygiene, but basically it's a set of good habits to encourage your restful sleep, especially તમને sleepના problems હોય. So this would be these are things to work on. And these are oftentimes these are lifestyle modifications that we can do without any medications. Okay. So these are these are not the complete list, but this is a good list to get started. So avoidance of late caffeine, appropriate sleep environment, not working, not watching, not eating in bed, things like that. Having enough time. તમે 6 વાગે ઉઠવું હોય ને તમે 12 વાગે સુવા જાઓ તો 6 I mean તો 8 કલાક જ નહીં જ મળે કેમ કે 6 જ કલાક છે. તો you have to leave at enough time કે at least તમને આટલા કલાક તો મળશે. Consistent bedtime routine અને બચ્ચાઓ અને આપણે તો નહીં પણ cats કે dogs કે હોય તો obviously પલંગમાં ના સૂઈ. અને try to avoid meals right before bed, at least 3 hours before, and then avoiding naps late in the day, obviously, because that'll affect the drives. આપણે જે કીધું હતું circadian rhythms ની પહેલા આપણે વાત કરી, that'll affect the drive for your natural ability to fall asleep. So this is not based on anything but my own impression કે આપના communityમાં આપનું cultureમાં these will probably be the most important ones that we could work on that most of our people struggle with. And I know મારા ફેમિલીમાં બી એમ જ છે કે ચાય તો પીવી જ જોઈએ રાતે સુવા પહેલા or at the end of the day તો that's a different issue. It's more maybe over a habit but especially potent caffeine જે હોય છે for example તમે energy drinks છે 5 hour energy drinks છે monster energy drinks છે તો obviously તમે રાત સુવા પહેલા પીશો તો તમને ઊંઘ નહીં આવે. Okay. I just took a funny picture, Shay. So when I try to go to bed early to get 6 hours, my brain, no. I thought that was funny. Okay. I પેલું disorders છે insomnia disorder છે. એનું definition છે કે it's a subjective report of difficulty initiating or maintaining sleep or early morning awakening. and it's 3 times a week. It has to be at least 3 times a week for at least 3 months. And with that, એની ઊંઘના disturbance તમને fatigue થાય છે, you're tired all the time. You might not feel as sharp cognitively. તમારો mind એકદમ જ આમ blurry લાગે છે, તમને મેમરીમાં તકલીફ થતી હોય, or તમને મૂડમાં તમને બી ગુસ્સો આવી જાય, તમારું ડિપ્રેશન થઈ જાય, sadness થઈ જાય, એમ બી થઈ શકે. It's quite common. It can be as common as even a quarter of the population, and it's chronic. એમ છે કે શોર્ટ ટર્મ નથી, ઘણા માણસો, ઘણા લોકો ઘણા મહિનાઓ વાસ્તે, ઇવન વર્ષો વાસ્તે આના સાથે સ્ટ્રગલ કરે છે. A QOL means reduced quality of life. So it does affect how happy people feel. There are 3 reasons for developing and having insomnia. We think that there's some genetic, obviously, risk factors, which we can't do anything about, and a personality. So, for example, કોઈના personality traits એમ હોય કે એકદમ જ perfect હોય, સગલું બધું perfect જ હોય, or એવું trait હોય કે એ લોકોને ઘણી અમે મેડિસિનમાં rumination કહીએ. એની માને એમ કે તમારો એક સોચ હોય ને ઈને ઈ જ સોચ ઈને ઈ જ સોચમાં હોય કે આ હોય આ હોય. તો એ જે ટ્રેટ્સ હોય તો એ શાયદ એ વધારે રિસ્ક ફેક્ટર્સ હોય કે તમને આ ઇન્સોમ્નિયા થઈ શકે. પછી જો આ હોય સગલું પછી તમને કાંઈ થાય, ફોર એક્ઝામ્પલ acute stressor, કાંઈ પ્રોબ્લેમ થાય કામમાં, યુઝલી જેવું સ્ટ્રેસર હોય કે તમારા પોતાનું કંટ્રોલ નથી એના ઉપર. So for most commonly આપણે adults વાસ્તે કામના stressors, પૈસાના stressors, relationship stressors, health related stressors, pain, કાંઈ surgery આવી હોય, કાંઈ હોસ્પિટલમાં હો, different situationમાં હો, અને હવે એનાથી હવે શરૂ થાય છે precipitating. ને પછી why does it keep going on? તો આપણે 3 મહિનાની વાત કરીએ, at least 3 months. So it keeps going on because you might have maladaptive coping. તો તમને આપ થાય છે, so the way you're dealing with it is making it go on and on and on. And for example, you might be tired, so તમે આખો દિવસ પલંગમાં હો, which is a bad sleep hygiene habit, or તમે આખો દિવસ caffeine પીઓ છો to get through the day. So, for example. So the main thing from this slide is the number 3. તમને આ જોવાય છે. So just to remember, so 3 times a week, 3 months, and then the 3 Ps. So predisposing, precipitating, and perpetuating factors. So, like in medicine, we try to treat what we can to reduce distress. તો જે દવાઓ હોય છે, pharmacological management હોય છે, તો આ થોડું બધું સગલું ડિટેલમાં નહીં કરું કેમ કે આ એક જ સ્લાઇડ એક લેક્ચર પર થઈ શકે, પણ બેસિકલી આ જે લેફ્ટ હેન્ડ સાઇડ ઉપર છે તો આ જે FDA approved છે, આ નોન FDA approved, અને આ ઓવર ધ કાઉન્ટર જે ઓપ્શન્સ બી છે. તો આના બારામાં થોડું જસ્ટ ઇન્ફોર્મેશન આપું છું, જસ્ટ ફોર પર્પસીસ આપના વાસ્તે, કે આ બેન્ઝોડાયાઝેપિન્સ જે છે, શાયદ સુનું હશે આ નામ, પણ એના કોમન નેમ્સ એમ છે દવાઓના, લાઈક ઝેનેક્સ, એડિવેન, વાલિયમ, ક્લોનોપિન. તો આ જેનેરિક નેમ્સ મેં લખ્યા છે અહીંયા. તો આ સગલી નામો આપણે સુના હશે. તો આ દવાઓ ઇફેક્ટિવ છે, યાની કામ થશે, તમારું કામ થઈ જશે, તમે સૂશો. પણ એનું ડાઉનસાઇડ એમ છે, એનું નુકસાન એમ થઈ શકે કે બિકોઝ એટલા ઇફેક્ટિવ છે તો તમારું થોડું રિલાયન્સ થઈ જઈ શકે એના ઉપર, અને હેબિટ બી થઈ જઈ શકે એ દવાઓ ઉપર. અને ટાઈમ પછી એ દવાનાથી ટોલરન્સ બી થઈ શકે, જેના સબબ આપણે વધારે લેવી પડે એ દવા. એના બીજા બી રિસ્ક ફેક્ટર્સ છે, મેડિકલ રિસ્ક ફેક્ટર્સ, મેમરીના રિસ્ક ફેક્ટર્સ છે, બેલેન્સના રિસ્ક ફેક્ટર્સ છે. તો શોર્ટ ટર્મ વાસ્તે શાયદ ઓકે હોય, પણ પછી long term વાસ્તે it's not recommended. Same goes for these medications. I think the FDA has approved 3 weeks, if I'm not mistaken. So short term treatment. આ બીજા દવાઓ છે, and they work differently. They work on different receptors. આપના ડોક્ટર સાથે તમે વાત કરી શકો, જેટલા તમારો જે હેલ્થ સિચ્યુએશન હોય, તમારા જે સાઇડ ઇફેક્ટ્સ હોય, એ બેટર સ્યુટેડ છે એ ડિસ્કશન વાસ્તે. Obviously, antidepressants છે, જે તમને થોડું વધારે ઊંઘ આવે એનાથી, anti-seizure medications બી છે, અને antipsychotics બી છે. Okay. Over the counter Benadryl, diphenhydramine, ટોક્સિલામીન જે થોડા હર્બ્સ બી છે જે આપણે વેલેરિયન રૂટ આપણે સુનું હશે કેમોમિલ આપણે સુનું હશે તો આ નોન પ્રિસ્ક્રિપ્શન ઓવર ધ કાઉન્ટર એજન્ટ્સ છે અને હમણાં મેગ્નેશિયમની બી ઘણી વાત ચાલે છે જે ઘણા જણા કહે છે કે લોકોને મદદ થાય છે સુવાની જો દવાઓ તમને ના પસંદ હોય દવા તમને પહેલા ટ્રાય ના કરવી હોય તો બિહેવિયરલ ટ્રીટમેન્ટ્સ બી છે અને આ જે આપણે વાત કરી હતી સ્લીપ હાઇજીન ઉપર તો ઈ મેજર ટાર્ગેટ્સ છે આ બિહેવિયરલ ટ્રીટમેન્ટ્સ વાસ્તે તો એક ટાઈપ ઓફ ટ્રીટમેન્ટ એમ છે કે સ્ટિમ્યુલસ કંટ્રોલ થેરાપી જો જે નોર્મલ ક્યુઝ છે આપણે સુવાના for example the bed the bedroom the bedtime those are the things that we try to work on and make them as consistent as possible because um, oftentimes especially in modern life so those cues are paired with different things so for example તમે તમારા પલંગમાં તમે કામ કરતા હો યા તો વાંચતા હો યા તો ટીવી જોતા હો યા તો ફોન વાપરતા હો તો પછી that stimuli is disrupting that cue કેમ કે તમારા બોડી એમ કહે છે કે આ તો પલંગમાં તો સુવાનું છે પણ તમે તો વાપરતા હતા ફોન વાસે વાપરતા હતા so it's getting a little confused so that's how this therapy works ક્લિનિકલ ઇન્ટરવ્યુમાં એની માના એમ છે કે તમારા ડૉક્ટર પાસે જાશો યા જે બી તમે વાત કરશો તો એને એ લોકો પૂછશે આ સગળા સવાલો પૂછશે તમને કે શું પ્રોબ્લેમ છે તમારા સ્લીપના તમારા શું ઇમ્પેક્ટ થાય છે તમે શું તમારી આદત શું છે સ્લીપની તમે શું કરો છો કેવારે જાઓ છો સુવાને જાઓ છો કેવારે ઉઠો છો આ સગળી સવાલો છે તો તમને સોચતા હો કે ઇન્ફોર્મેશન તમને પ્રિપેર્ડ હો આપવાનું એક સ્પેસિફિક ટાઈપ ઓફ થેરપી બી છે એ તો પહેલા જે એપ્રિલમાં આપણે જે વાત કરી હતી સીબીટીની બી આપણે વાત કરી હતી પણ આ એક સ્પેસિફિક ટાઈપ ઓફ સીબીટી છે સીબીટી થેરપી ફોર ઇન્સોમનિયા ઓર સીબીટીઆઈ and that combines the principles apne je વાત કરી હતી last slide ઉપર and also something called sleep restriction therapy એ શું છે કે it reduces your arousal excuse me by keeping you out of bed until તમને એકદમ જ ઊંઘ આવે until you're very sleepy the goal is to reduce the time it takes to fall asleep and the time spent awake just one more time, stimulus control nuche. I know I'm kind of going over and over this, but I just want to make sure that everybody is on the same page. So avoiding the bed for other activities other than sleep or intimacy. And then if you can't sleep for more than 15 to 20 minutes, then you should get out of bed. Don't go and watch TV. Don't go and use your computer. Don't go and use your phone, but maybe doing another quiet activity like reading something or Quran Majid tilawat apne magazine apne આ લોકોને કહીએ છીએ something that doesn't cause you a lot of stimulation and then coming to bed only when you're tired and you're feeling tired and પોતે sleep થાવ and last but not least the most important thing I would say is getting up at the same time every day at least when you're doing this when you're trying to train yourself so even if તમને એક વાગે ઊંઘ આવતી હોય getting out of bed at 6 in the morning for example તમને 6 વાગે ઉઠવું હોય or ઉઠવાનું હોય તો 6 વાગે જ ઉઠો અને પાછું સુવા ના જાઓ the reason for that is કે તમે let's say 1 વાગે સુવા જાઓ પણ તમને 8 કલાકની જરૂર હોય so then you're sleeping till 9 તો પાછું ઈ જ સાયકલ આખું રિપીટ થશે એમ નહીં કહેતો કે તમને ઊંઘ નહીં આવે so if you get up at 6 that day you'll be very tired the next day you'll be very tired the third day but ideally over time તમને ઓછું ઊંઘ આવશે or sorry ઓછું fatigue આવશે ને વધારે ઊંઘ આવશે especially earlier આ બી એક થોડું funny picture છે using my phone because I can't sleep because I'm using my phone so they're both tied together very closely આ બે બીજું ડિસઓર્ડર છે એકદમ જ એક જ સ્લાઇડ છે જલ્દી થોડું કરી દઉં છું આનું it's the opposite of insomnia it's called hypersomnolence disorder and so that's excessive sleepiness so આમાં ઇન્સોમનિયામાં તમને ઊંઘ નહોતી આવતી આમાં તમને ઘણી ઊંઘ આવે છે પણ એના સબબ એના સિવાય તમને હજી rested feeling નથી આવતું so even though you're in bed even though you're sleeping even up to 10 hours or more હજી બી તમને ઊંઘ નથી આવતી and it can be associated with other mood disorders like depression like anxiety mostly depression and then there's also some medical issues as well like narcolepsy insufficient sleep and idiopathic hypersomnia I'm not going to go into too much detail about those they're more rare than insomnia There are some movement disorders that are related to sleep. The most common one is restless leg syndrome. तो आपने ना पारामा भी एक slide share. So restless leg syndrome, what that is it's an intense urge to move your legs that may be associated with discomfort in the legs. And oftentimes the description apne આવી છે, it's a creeping, crawling, tingling, aching type of discomfort or feeling. It's hard, sometimes it's also hard to describe, but those are the words that people use are most closely associated with this. It is more common in women and particularly as they age. It's worse later in the day, and it gets worse as you're resting, as you're sitting down, maybe watching TV or trying to go to bed. Because it's restless legs, so you move your legs, you stretch your legs, and that can bring either a little bit of relief or even total relief. You can imagine વિચાર કરી શકીએ કે કોઈ સ્લીપ કરવા જાય, રેસ્ટ કરવા જાય, and all of a sudden એને move કરવું પડે, એના પગને move કરવું પડે. So it obviously disturbs their sleep to get them into deeper levels of sleep. And then that's also affecting their functioning during the day. Certain medical conditions are associated with it. Iron deficiency anemia is common. Again, iron deficiency anemia also more common in women because of their menstrual cycle. So that might be a relationship there. But it is associated with the menstrual, iron deficiency anemia. So they should check your iron levels. There's other hormones that they can check as well. And sometimes it's relieved by iron supplementation as well. This is treated with that. Other medical issues like chronic renal failure and even pregnancy, not a medical issue, but a condition, it can be worsened in pregnancy as well. These are the આજે દવાઓની નામ છે જે આપણે વાપરીએ છીએ અને treat કરવા વાસ્તે. These are the names of those medications. And the other thing I wanted to mention, family history, restless legs. તો કોઈ તમારા ફેમિલીમાં especially મા બાવા ભાઈઓ બહેનો એ લોકો પાસે હોય તો તમારા વાસ્તે બી એ પછી risk factor થઈ જઈ શકે. Breathing related sleep disorders. So I think we'll spend a few more minutes than the other ones, but there's two types of breathing related sleep disorders. There's central sleep apnea and obstructive sleep apnea. I won't go into too much detail about this one. Again, just more informational વાસ્તે છે. અને આ પહેલા આપણે વાત કરીએ છીએ central sleep apnea. Sleep apnea એટલે એની માના એમ છે કે આપ ઊંઘતા હો અને breathing નથી થતું, નહીં કરતા breathing. And there's different reasons for that. So for central and for obstructive, the reasons are different, but the effects are essentially the same. What's happening is that you're having these cycles of breathing and you're stopped breathing even for up to 2 minutes. आप imagine કરી શકો કે આપ શ્વાસ ના લેતા હો તો શું થાય. So obviously તમારો oxygen levels નીચે જશે અને carbon dioxide જે આપણે produce કરીએ છીએ એ ઊંચું થશે. And that's a signal પછી brain વાસ્તે કે તમને ઉઠાવે. તો તમે deep sleep માં હો તો even then it'll wake you up because obviously you have to breathe. And it may worsen seizures for people who have epilepsy. So that's a risk factor. But then it can also cause, then it can cause angina, which is chest pain. It can cause arrhythmias, rhythm problems, and it also can result in heart attacks. Certain things can cause this sleep apnea and things that depress the central nervous system. So anesthetics, alcohol, we talked about the benzodiazepines earlier, and opioid pain medications um, oxycodone, those types of medications. And then, so it's fairly rare, so I'm not going to spend any more time on it. Okay. Oops, sorry. Okay. Obstructive sleep apnea. Sunuj has said no talk on sleep medicine is complete without talking about sleep apnea, so we have to talk about it. This is all the information that I think you should have for sleep apnea. What it is episodes of non-breathing or low breathing overnight. Because of that, it causes disruptions in your sleep and it prevents you from getting deeper levels of sleep. These are the things that you might experience if you have sleep apnea. So really kind of take this away. Maybe I should have highlighted it, but fatigue, drowsiness, easily falling asleep, and noisy breathing. Those are kind of the cardinal symptoms of it. I'll get into this in a second. I think the next slide, Shahid Hassan, but it results in head to toe issues from your mind to your legs. It can result in worsening of your health. Obviously, like most medical conditions, it's better to treat it early. It's confirmed with an overnight or at-home sleep study. And then you can treat it with CPAP. There's some surgeries associated with it, and you can even get like a device that's implanted. It's much more common than central sleep apnea. If you have more than 5 events an hour, it's almost a third of men and about a fifth of women. And unfortunately, like most medical conditions, it's more common as you age. So for those who are 65 and older, it's 90% of men and 78% of women. It's quite common. I video che. I hope it works. I don't even let me know if it doesn't work and I can stop it.
When we breathe, air travels down the throat, through the windpipe and into the lungs. The narrowest part of that pathway is in the back of the throat. When we're awake, muscles keep that opening relatively wide. But when we sleep, those muscles relax. That narrows the opening. The air passing through may cause the throat to vibrate. That causes snoring. Obviously, many people experience this.
Sorry. Okay. Okay. So I mnemonic છે stop bang કરીને છે.
Okay, we're back over there.
Sorry. So
Not done.
stop bang mnemonic છે. And it stands for, so these are the risk factors for obstructive sleep apnea, okay? Snoring, feeling tired, observe stop breathing. So, like, for example, તમે કોઈના ઘરે સુવા
And
જાઓ
you're gonna
and
put the mud.
you had a nap and somebody says that you were sleeping ને તમે breathe નહોતા થતા. So that's observe stop, stop breathing. If you have high blood pressure, that's a risk factor. If your obesity, if your weight to height ratio is high, then you have a higher BMI, that's a risk factor. If you're greater than 50, if your neck circumference, measurement if it's more than 40 centimeters, and then if you're male, these are all risk factors for developing or for having sleep apnea. And it's scored out of 8, as you know, each one of these is 1 point. If you have 2 or less, then you have a low risk. If you have 5 or more, then that's a high risk. So just a quick note on sleep studies, what that means. So अपने doctor शायद तुमने recommend करे कि sleep study करो. So I think it'd be good for you to have some information on it. So what it is a procedure that's determined after you meet with the sleep medicine doctor. As I said, it can be in lab or at home. They measure a lot of things. They get a lot of information during a sleep study, and these are some of the things that they measure. And then it can diagnose a lot of different sleep disorders as well. It's not just for obstructive sleep apnea, but because they get so much information, they can diagnose other disorders as well. So they measure your muscle, they measure your heart, they look at તમારી oxygen આખી રાત વાસ્તે લોકો measure કરે, brain waves એ લોકો measure કરે, and so this is a picture of what it looks like. Obviously, at least મેં તો પહેલા જોઉં છું તો મેં વિચાર કરું છું કે આટલા વાયર સાથે આટલા મેઝરમેન્ટ સાથે ઊંઘ કેમ આવે. પણ એ જે સ્લીપ મેડિસિન ડોક્ટર સાથે વાત કરી છે તો એ લોકો કહે છે કે you be surprised people actually do fall asleep even with all these wires, and if there is a problem તો એ લોકો એક દવા આપી શકે that will help you sleep for that one night. But this is what it would look like. Now, let's say you are diagnosed with obstructive sleep apnea. So one of the main treatments is something called CPAP, which stands for continuous positive airway pressure. And what that means, I know details sorry if it's too detailed, but basically what it does is it's blowing in air into this pipe. And as you're breathing, it's enough air, that pressure is enough air to keep your airway open. So that airway doesn't close. So you don't get the same. There's different types of masks. So these are just nasal pillows. They call these, just on the nose. And this is what the machine might look like. Obviously, different types of machines, different types of masks. Some are mouth only, some cover both, some cover just the nose. Okay, I did total. I think a health series initially, women's health series too, but obviously sleep is a men's and women's issue. So when I sleep in pregnancy in total, what karu. So for those who are interested in this, but if you have disruptions in your sleep during pregnancy, it's related to all of these types of issues during pregnancy, including glucose intolerance, which means get the amount of sugar might be harder to control, which then might predispose you to gestational diabetes. I think it'd be very rare to meet a woman who's not tired during the day, but part of it might be because they're not getting good sleep overnight. Getting up to pee during the night. It can be associated with heart rate increases, shortness of breath, aches and pains, heartburn, and of course, stress. It's also related to that. And then heartburn is because of the physical changes that happen during pregnancy. There's a couple of reasons, why is it during, beyond the obvious reasons of being in your 9th month and having a large belly, but there are hormonal changes that happen during pregnancy, including progesterone, which actually promotes daytime sleepiness. So as the pregnancy progresses, and I'm not the expert in this, but progesterone goes up, so then you're more likely to feel sleepy. And then it also causes fragmentation of your sleep overnight, that hormone, just progesterone itself. Oxytocin, also associated with pregnancy, it's responsible for contractions. It peaks at night, and so it actually causes disruptions in your sleep at night as well. There are physiological changes, like I just mentioned, with heartburn, for example. So that means your body itself is changing. And then that results in pushing on your diaphragm, for example, pushing on your stomach, causing the heartburn, causing the shortness of breath. And then not to mention, well, I mean, I should mention it as a psychiatrist, so psychological changes as well, the stress, worries. If you meet a pregnant woman who doesn't have any worries, she would be in the minority, because 78% of women reported that they worried during pregnancy, and actually the sleep during their pregnancy was the worst in their whole lives. So if you sleep for less than 6 hours consistently, of course, during pregnancy, that's associated with longer labor and also C-section. And then it's also associated with poor neurodevelopmental outcomes. So how do we help people in pregnancy with their sleep? Or how do we help women in pregnancy with their sleep? We obviously the same things we talked about before, but in addition, we might try to do some things specifically for nausea, relaxations, leg cramps, and then short naps during the day to make up for for the night, for the disruption during the night. Of course, દવાઓ બી છે જે pregnancy માં વાપરી શકો, પણ majority of pregnant women would prefer not to use dawao, and for obvious reasons, for good reasons, because dawao are passed on to the developing baby. But there are medicines that cause problems in pregnancy, and then there's medicines that we're not sure if they cause problems in pregnancy, and we use them, and they do help. Okay, sleep and depression. So 90% of those with sleep have, 90% of those with depression have sleep disturbances. And even if the depression gets better, they can still have problems with their sleep. Early morning awakening, what that means is એની માના એમ છે કે તમને 6 વાગે ઉઠવું હોય, તમારો અલાર્મ 6 વાગે ઉઠવું હોય, પણ તમારા ડિપ્રેશનના સબબ તમે 4 વાગે ઉઠી જાઓ. So that is a risk factor for suicidal thoughts, જે આપઘાત કહીએ છીએ આપણે. So that's a risk factor કે ઈ તમને એમ થઈ શકે, ઈ સોચ આવી શકે. And early morning awakening is very commonly associated with depression. Insomnia is a risk factor for major depressive disorder. And આના વાસ્તે both therapy and medications, આપણે વાત કરી પહેલા sedating antidepressants ની and different types of therapy, તો આના વાસ્તે specifically આ બી મદદ થાય. Depression માં આપણે પહેલા સ્લાઇડ ઉપર જોયું હતું જે waves હોય છે, જે sleepના waves હોય છે, જે different sleep levelsમાં હોય છે, stagesમાં હોય છે, તો એમાં આપણે જોવાય છે, આપણે એક sleep study કરીએ, જે એકદમ જ કોઈ depressed હોય તો એને આખું એક sleep study કરીએ. So what you'll see different effects on the waves actually, and how long the cycles last, how frequently they last, how the REM cycles happen. And they also have rapid eye movements as well, increase of those during depressed episodes. Anxiety, again, very few anxious people sleep well. So most people who struggle with anxiety struggle with sleep quality. and that's associated with frequent awakenings. Rate loko uthe, fikar ma hoy, loko restless hoy, can't get comfortable tossing and turning. And much severe bhi hoy, to actually loko uthine, they can have an anxiety attack. They can wake up in night sweats, shortness of breath. Mostly it's associated with nightmares, but even just with anxiety, that can happen. If somebody has OCD, then they're more likely to have sleep disturbances, and OCD itself is associated with rhythm disorders. And then you can have sleep changes in your architecture as well, including not sleeping enough, decreased sleep efficiency. So those are the effects. A slide, actually, I'll be honest, I stole it from my previous presentation. It's the exact same slide because these three things are so important. So I wanted to bring them up again, and if they invite me again, I'm sure I'll have it in my next slide as well. But sleep, diet, and exercise, those are helpful for overall health, not just mental health or sleep in this case. Be protective of your sleep. So what that means is that, as I said પહેલા કે તમને 6 કલાક or 8 કલાક જોતા હોય ને તમે 6 કલાક જ આપતા હો તમારા વાસ્તે sleep કરવાનું, so then you're not being protective of your sleep. So I know બધા પાસે કામ હોય છે, we're all busy, we have all commitments, but on a chronic ongoing basis, if your sleep is disrupted, that can cause a lot of the problems we've talked about. A balanced diet, a Mediterranean diet. You can Google this, you can look it up what that means. When we talked about it in our last presentation, but it's a fruit and vegetable heavy diet, processed food, very, very few processed food, very light on processed foods and meats and those types of things, sugars, less of those, less caffeine, less sugar, less processed foods, as I said. And then exercising, the goal is 30 minutes of a week. Aerobic exercise, any mana em che, કે તમને તમારો હાર્ટ રેટ ઊંચું થાય અને જસ્ટ તમે આમ એક્સરસાઇઝ કરતા હો અને તમને આમ વાત કરવાનું થોડું મુશ્કેલ પડે, like થોડું આમ short of breath થઈ જાઓ. That's when you know you're kind of in the aerobic range. It's a very crude way of knowing, but that's the aerobic, and so 30 minutes of that a week. How do you know if you're getting enough sleep? Well, hopefully I've given you enough information during this presentation that you will be able to tell if you're getting enough sleep. But if you're not, then this is to kind of just put a spotlight on it. But Chaoma, they might be actually have the opposite. They might be overly active. This past weekend I saw a young kid and she was very, very tired, but she was still very active and she was walking around, but she was still very tired. And then school age children, they might have problems paying attention. Behavioral issues like anger and like temper tantrums, children do that all the time. Young babies do that, toddlers. Mood swings for older children, feelings of sadness, lack of motivation. And for, as I said, older school children, their performance might suffer as well. Apna adults ma, to these are some warning signs. These are actually warning signs for sleep apnea. But this will be obviously for insomnia as well. So if these things are happening to you, then that might be a risk factor or a warning sign for you. So dozing off, what that means is કે એમ નહીં કે તમને deep ઊંઘ આવે, તમે નસકોરા ખેંચતા હો કે એવું કંઈ નહીં, પણ તમે આપણે એમ કહીએ ને કે સુસ્તી આવે છે, આમ ઝોકા ખાય છે. So that's what dozing off means. And in common daily situations કે જે ના આવવું જોઈએ. So reading and watching TV, for example, sitting in a public place, if you imagine, for example, sitting in traffic for a few minutes, then that would be very dangerous. That's, obviously a risk for yourself and others. Okay, છેલ્લું slide છે, and પછી જેવી સવાલો હોય, inshallah we'll address those, but these are the take-home points. તમને ઊંઘ આવતી હોય, if you're not functioning well during the day, if you're feeling fatigued, especially if you feel like you're getting enough sleep, then please talk to your doctor about it, get some help. And because the reason for that is medications and therapy can be beneficial. મેં ભૂલી ગયો કહેવાનું, પણ જે sleep apnea આપણે વાત કરી હતી, obstructive sleep apnea માં જે mask પહેરે છે, I know આમ ના વાપરતા હો ને આપ જોતા હો, આપ ફોટા જોતા હો, તો પાછું એવું વિચાર આવતો હશે કે આ તો આના સાથે mask સાથે તો કેમ મને ઊંઘ આવે. So the reason, but many people will say that once they started using their CPAP, it's actually a life-changing thing for them, and because it's important to sleep for their overall functioning and well-being. And then you have control over this, so you can make the choices to help with your sleep. You have the choice to not drink coffee or an espresso right before you go to bed. You have the choice to not use your phone right before you're going to sleep or in your bed. And again, do as I say, not do as I do. I'm guilty as anybody for doing all this, but this is things that we can do if you're struggling with your sleep to help yourself with your sleep hygiene. Okay, shukran.
Thank you very, very much for that very detailed talk. I know it was a little bit of it was a little bit tough for me to ask you to cover such a big topic in the space of an hour. So you did amazingly. Thank you. There is so much when it comes to sleep, right? Like it affects every part of the body and something else could be causing it. So I think this is something that affects everyone to a certain extent. Let's open up for questions. And see if anyone has any questions, feel free to unmute or you can comment in the chat. I think there is one. So someone's asking thoughts on use of slow release melatonin and magnesium for long-term use.
Yeah, so actually, melatonin is so jene khabar na hoy, melatonin is something that's released by our brains. It's a hormone, and it's released by a small little gland in the brain. It's called the pineal gland, and it's naturally released. So it's part of the circadian rhythms. તો જેવારે બી તમને like જેવારે રાત થઈ જાય છે, so lack of light, then melatonin starts being released because it's trying to signal to your body, it's trying to signal to your brain કે હવે ઊંઘનો time છે. The amount that the pineal gland is releasing is very, very, very small. I think, if I'm not mistaken, in the micrograms, very, very small amounts. But anyways, but sleep melatonin je exogenous melatonin છે, meaning કે તમે supplement લો. So for many, I think for a long time it's been like sort of many people will say, oh, it's natural, it's a hormone, lay low. But I was actually reading an article recently when I was preparing for this talk, and so it's not completely like benign either. Especially the long-term effects of it are not completely understood, and how it affects, as I said, the circadian rhythm. I think there was some association with infection as well. So, I mean, 3 milligrams of melatonin, if it usually, I mean, ideally when it first came out, it was meant for people with jet lag and short-term sleep issues when they were going to go away or when they were going to be traveling, especially business people. That's how it really started. But then now it's become very, very popular. People are using it in children. Off the top of my head, I don't know of any like specific time frame કે આટલા મહિના વાસ્તે આટલા અઠવાડિયા વાસ્તે જ વાપરવું જોઈએ. But I would suggest using it for short term just to help your brain with this signaling કે હવે સુવાનું છે. Magnesium, the other part of the question was magnesium. I don't know enough about magnesium supplementation to comment on that right now. Sorry.
Another question. Salam, and thank you for the informative presentation. My wife experiences some itching in the side of her throat and then coughs. That causes her to wake up. Sometimes she feels like a choking effect.
Yeah, I mean, Fatima Bin's probably the more of an expert on this, but first thing that came to mind when I heard coughing was maybe a medicine, maybe like an ACE inhibitor or something like that, causing, I don't know. So that's why you probably should seek to your doctor. They would know your medical history more. It could be a side effect of medication. Obviously, you mentioned ke in a pagma dard thatu hoy, so that it could be restless leg syndrome. So we could go back to that slide. We could review it, see if she has any of the other symptoms of it, and then if it's bad enough, if she's having the fatigue that we talked about, and it's interfering with her functioning during the day, then it would be worthwhile, I think, to definitely talk to your doctor about it, or a doctor about it.
That's very, very typical actually of these sleep issues, right? Where some conditions will cause you to not sleep, whereas others will be as a result of the sleep problem itself.
Right. The hand in glove situation.
Exactly. At what point would you consider for people to be on medication for sleep issues? Because obviously there are a lot of things that they can, as we've seen from here, to get investigated. But would you advise concurrently being on medication to help stop it from getting more of a chronic issue, or would you recommend they investigate it first and then consider medication if everything else is negative?
Yeah, it's a great question. Was that your question, Dr. Mohammed?
Yeah, just
Yeah,
it's something I get asked often. I just want to see what you would say
I was
to
gonna be
it.
surprised. I was gonna be surprised if somebody asked that. It was a very good question. So it depends on, I think, the issue that the person is having and the history, right? So obviously, if they're snoring and if they have a OSA or obstructive sleep apnea symptoms, then probably treating obstructive sleep apnea rather. So that's the other thing I wanted to mention as well. कि obstructive sleep apnea ma just because apna paase hoye, we don't know कि apna paase che ke nahi without getting the workup. So what some people will do is they'll medicate it away, not necessarily with medicines, but they might medicate it with sugar, for example. Right? There's only two ways to get energy in life, and that is with sleep or with food. There's really no other way to get energy. We can't photosynthesize the light. So then people who have fatigue, then they might be drawn to quick energy sort of foods like sugars, high in sugars, or they might be drawn to caffeine. In medicine, we might be tempted to use a stimulant medication like Ritalin or Adderall because we know that that can help them stay awake. And so, that might be a point where you might say, well, they don't have any other symptoms causing this, so maybe we should get a workup first. To answer your question, when should you use medicines? Again, it depends on the situation, how much it's affecting their lives. If they're having insomnia, the behavioral treatments for insomnia do take some time to work. So, and that they have to do that, whereas medicines, they just have to take it and then the medicine will do the work. So it depends on the patient, depends on how motivated are their preferences. They have a big presentation next week and they need to get some sleep this week. Ewu kai hoi, if they have an exam coming up, those types of situations might lend better to short-term medication management rather than long-term behavioral therapy.
Thank you. There's just a comment. Great presentation. Very informative. Thank you. And then, Salam, are there any food recommendations to decrease sleep problems?
Yeah, actually, I was thinking about this. I jumped to rate, I was thinking about this. I knew that food no to outside. So sorry, the question was food recommendations to decrease sleep problems.
Yeah.
Nothing immediate comes to mind. Obviously, like we mentioned before, avoiding eating a heavy meal very close to bedtime because that affects your digestion. It can cause heartburn. Those issues. There are certain sleep medications that can help with sleep, or certain foods and food types, like I mentioned, the herbs. There's chamomile, for example, chamomile teas, so those might help with sleep. But there's nothing that necessarily will make your sleep worse that I can think of.
And they're saying any fruits or herbs. Okay.
Just chamomile, valerian, those are St. John's wort, those are available over the counter.
And as you said, to avoid sugar and caffeine close to bed. Feel free to unmute to ask questions as well. You don't have to type it in, especially if you feel it's a long question. There's another question. So thank you for the informative webinar. Enjoyed the slides and humor regarding chai before bed. Sorry, Fatima, when you were about to ask a question?
I have a question, but I'll wait to be called.
Oh no, feel free. That's I was talking to you.
Oh, okay. So, what do you recommend as a time to have dinner before sleeping, like to get good sleep? Do you have like any, like you should, if you sleep usually at 10 o'clock or 11 o'clock, maybe you should have dinner by this time. Do you have like any
So,
recommendations? Because I'm diabetic too. So,
mhm.
and that was also kind of a a second question, because I'm a diabetic. Um, do you recommend early dinner, or I don't know, like should I exercise before sleeping? Um, I just want, and I have slight sleep apnea issues.
Sure. Yeah, thank you, Padmavan, for that question. So I think I can't really answer that specifically for your case. The reason for that is it would depend on what your sugars are doing, first thing in the morning, early overnight, and probably a better question for your regular doctor because they know, your insulin, how much you're taking, or whatever medications you're taking, and maybe those need to be adjusted, etc. So I won't be able to give you advice specifically on what you should do with regards to your diabetes and when to eat but this I'm pulling up this slide again just because this is according to a website that I got this from I think it was the National Sleep Foundation. For the recommendation is 3 hours before bedtime. It's a hard and fast rule, but they're just recommending the idea is que sua pella, like, tame palang majata ho ne jamta ho. I think is the major takeaway point there. As far as exercise goes, I do know that if you sleep right before bed, then that would disrupt your sleep because exercise, especially the type of exercise like aerobic exercise, that's the opposite of sleep because your sleep, your heart rate is going down, you're relaxing, your respiratory rate is going down, your blood pressure is going down for most of the night. So obviously, if you're exercising right before sleep, then that's going to be a disruption in your cues, like we talked about before, for restful sleep, especially to fall asleep quicker. So I guess the question becomes, what is that right before? Is it? I think of right before as the last half an hour before bed. That's in my mind. That's how I think about it. But yeah, again, I didn't find that number anywhere. I think some
Yeah.
of this stuff you have to kind of base it on how your own experiences and your own habits are.
I know as you said, there isn't really a clear definition, but for as long as I can remember, we've always given the guidance of 2 hours, especially for exercise, to do it 2 hours before bed.
Mhm.
As well. There's another question. So there's two. I'll read both of them and then you can answer them in the order you'd like to. So one is, Salam, why am I experiencing insomnia and waking up seeing people or hearing someone call me?
Mhm.
And the second is sleep apnea related to waking up for the bathroom or to enlarged prostate?
Mhm. Great questions. Excellent. Thank you for whoever asked those. So, sorry, what was the first question?
The first is, why am I experiencing insomnia and waking up seeing people or hearing someone call me?
Insomnia.
Yeah.
They're experiencing insomnia, so they're having difficulty sleeping, and then they're
Or
having
waking
these
up with
voices, and
hallucinations,
they're
yeah.
having these, yeah. So there's two rare types of hallucinations, but they are possible. They're called hypnagogic and hypnopompic hallucinations, though they're actually associated with sleep apnea as well, but that doesn't mean that they're just in sleep apnea, but those hallucinations are associated with your sleep. And so hypnagogic hallucinations are when you're falling asleep, and then hypnopompic hallucinations are when you're waking up. So the theory behind those is that you're having these connections between your stages of sleep, like REM sleep, like deeper levels of your sleep, and then with your waking hours. So there's like this kind of overlap, and that's what's causing it. And the second question was?
Is sleep apnea related to waking up for the bathroom or to enlarged prostate?
Yes. I'm not 100% sure about enlarged prostate, but definitely with waking up during the night to go to the bathroom. And there's a very simple mechanism and very simple explanation for that, and I'll explain it if you guys are interested in it. But essentially, what happens is, tame suta ho, and let's say you have sleep apnea, okay? So tame suta ho, and tama breathing band thei jai che. Tame sleep apnea ho, aseto. If you're snoring, you are making the noise, and your airway is actually getting narrow and narrow and narrow. And as the airflow is going over that narrow airway, that's what's causing the noise. That's what snoring is. So why don't people snore during the day? કેમ આપણે ઉઠા હોય છે તો snore નથી ખાતા કોઈ? Because your muscles are not relaxed, so there's no turbulence over that airway. Okay. So as you're sleeping, let's say you stop breathing. હવે આ બંધ થઈ ગયું, આ airway આખું બંધ થઈ ગયું. તો પછી શું થાય છે કે તમારું brain એ કાર્બન ડાયોક્સાઇડ જે છે એ picks that up as a signal કે oh shoot આ problem છે આને ઉઠાડો. તો તમારું brain તમને ઉઠાડે છે. Then you wake up. And because you oftentimes you're in deeper sleep when you wake up or trying to fall asleep, it stresses you out. And your heart gets stressed out. And your heart starts beating faster. હવે, because your heart is beating faster, your brain thinks that there's a problem with your blood flow because your heart shouldn't be breathing faster. So then it sends a message to the kidneys and sorry, I'm blanking. What's right above the kidneys? The adrenal glands.
Yeah.
And it sends a message to the adrenal glands to say that we have too much fluid in the body. That's why this person's having their heart beating so fast. So you need to make more pee. And so that's what happens. So you end up making more pee, which makes you go to the bathroom more. So definitely, and that's the other reason I said people with CPAP sleep so much better because they're not getting up, not just because of the snoring, but they're also not getting up to pee as often overnight. Sorry for that long explanation. I hope it helped.
And with regards to the prostate issue, it doesn't directly is not related to, it's not a cause of sleep, but it can make your sleep worse. So an enlarged
Right.
prostate will also cause you to have difficulty peeing. So you might pee less and so more often, and so it might wake you up. So actually the opposite effect of what you said, right?
Right. Right. No, but I don't think enlarged prostate is associated with sleep apnea. That's how I took it.
No, yeah, it's not associated. In terms of so the next question is, how do you get your REM cycle to come earlier in the night?
How do you get your REM cycle to come earlier in the night? Well, you could try to fall asleep sooner. That would be probably the easiest way. But એકવાર ઊંઘ આવી જાય, then we don't have any control over what cycle or what stage we're in. That is we don't have any control over that. So we can't say કે હવે મને REM sleep માં જાવું છે, so I want to go into REM. Like we can't choose to do that. So I don't think there'd be a way for you to do that.
Great. So we're actually a little bit past the hour. So thank you so much for your time and this great presentation. And thank you everyone for attending. Inshallah, we're gonna return in January, so towards the end of January, the 26th, for a talk on heart related conditions. All of these talks in this series are for preventative health, so to prevent issues. So please do attend. Inshallah, Dr. Mustafa Bai will be back with a couple of more interesting, insightful talks. So we'll keep sending the links out. But yeah, great. Have a great Christmas time, and inshallah, we'll see you in the new year.
Great. Thank you very much. Thank you very much,
Hafiz.
Saglan, for attending, and hope it was informative. Duani Iltimas. Good Hafiz.
Hafiz.